I'm going to first verify the patient's medical record to ensure that I'm going into the patient's room today to check their glucose and administer insulin. I'm going to walk into the room. Hi, my name is Megan. I'm going to be your nurse today. What's your name?
Crystal Garcia.
Your date of birth?
March 16, 1994.
Do you have any allergies to medications?
No.
Okay. Do you know where you are?
Yeah, I'm in the hospital.
Who's the president?
Donald Trump.
What year is it?
2020.
And why are you here?
To control my diabetes.
The patient is alert and oriented ×4. She does not have any allergies. I'm going to go ahead and wash my hands and don gloves. What we're going to be doing today is checking your blood sugar. So I'm going to go ahead and I'm going to use the glucometer, the test strips, which I've already verified are not expired, a lancet, and a gauze with alcohol and a regular gauze. Have you ever had your glucose checked before?
Yes.
Okay, so it's just a prick on your finger, okay? So I'm going to go ahead and first I'm going to take the alcohol wipe. I'm going to wipe your finger laterally with the alcohol. I'm going to take the lancet and prick your finger. I'm going to wipe away the first drop of blood with a gauze. And then I'm going to go ahead and take the glucometer and check and collect the first drop, the second drop. The glucose is reading at 270. This means you're going to have to get some insulin done today, okay?
Okay.
So I'm going to go ahead and go to the medication room to collect your insulin, and I'll be right back, okay?
Okay.
Go into the medication room. I'm going to go ahead and check the medication order to confirm what medication I will be giving. I have the NPH and the regular insulin. Neither are expired. I've already checked the dates. I'm going to clean the tops of each one with an alcohol pad. I'm going to go ahead and roll the NPH in my hands for a few moments. The order reads 10 units of regular insulin and 3 units of NPH. I'm going to insert 3 units of air into the NPH and 10 units of air into the insulin. I'm then going to draw 10 units of insulin and confirm that with my second nurse that it's 10 units. And then I'm going to draw 3 units of NPH from my second vial and confirm that as well with the nurse. I have 13 in total. I will recap my needle. I'm going to discard my materials to their appropriate place and go back to the patient's room. I have the insulin needle already labeled with the patient's name and my initials as well as the time. I have 5 minutes to inject this. I'm back in the patient's room. I'm going to wash my hands and don gloves again. Can you confirm your name?
Yeah, my name is Crystal Garcia.
And your date of birth?
March 16, 1994.
Okay, perfect. Where do you usually have your insulin injected?
I usually have it on my upper arm.
When was the last time they injected it? Where did they put it?
They injected it on my abdomen the last time.
Okay, perfect. So since we're rotating sites, we're going to do your arm today, okay?
Okay.
You don't have any allergies to medication?
No.
Okay, so I've confirmed again the patient does not have any allergies to medication. I'm checking the MAR again to confirm that I have the correct dose, route, patient, and medication. So I'm going to go ahead and scan the patient's bracelet as well as scanning the medication to make sure that they match. And then now I'm going to go ahead and inspect the patient's skin to make sure that she does not have any lesions or any skin breakdown. Perfect. She does not have any lesions or skin breakdown. I'm going to wipe it with alcohol. Then I'm going to go ahead and take the needle. I'm going to pinch the skin and inject the insulin at a 45-degree angle. Then I'm going to release the skin and remove the needle. I'm going to discard the needle in the sharps container and the pads that I used in the biohazard. I'm going to go ahead and remove my gloves and wash my hands. I'm going to educate the patient. So what you're going to be watching out for is any signs of hypoglycemia. So any fatigue, any clammy or coldness in your skin, any tremors or anything like that, you're going to report to us immediately if you start feeling that way. You're also going to be eating in the next 10 to 15 minutes just to avoid any high-carb meals or any high-sugar meals, okay?
Okay.
Do you have any questions?
No.
Okay, perfect. So now I'm going to go ahead and document everything that was provided to the patient, the education, the medications that were used, and the procedure and her tolerance. Thank you.
You're welcome. Thank you.